So this is a closed system suction catheter. And what that means is that the suction catheter itself is inside this sterile bag. It has demarcations on it so you know how far down you're going. And the suction control is on the end here. It's like a little button. Can you tell the difference besides one is longer and one is shorter? Why would there be two different sizes, do you think? Well, this one is for a tracheostomy, and this one's for an endotracheal tube. Because if you remember, the tracheostomy is almost directly into the lungs. The endotracheal tube has got to go in through the oral, the oropharynx, and down. So it's much longer. So when this goes on to the patient, this is going to be a sterile procedure, and this is going to stay on the patient for 48 to 72 hours, depending this one catheter on the hospital's policy. They did find that by doing a closed system suction, that they decreased the amount of ventilator-assisted pneumonias that occurred in patients, and that led to a better patient outcome. Okay? So when this is on a patient, this patient is on a trach collar now. We'll take this trach collar right off, and we are going to place this patient on a closed, this patient is now on a ventilator. See it right over there, imagine it in your mind. And this patient now has a suction catheter attached to them all the time. The sleeve keeps it sterile. Now, you don't, this button that controls the suction, if this gets stuck under the patient's armpit, we'll do a constant suck and suck all that oxygen out. So this button has a lock on it. All you do is pull it up, twist it around, it's locked. So that when you go to suction the patient, you tell the patient, if they're on the ventilator, you're going to hit the 100% O2 and let that cycle for a minute or two at least before you suction the patient. Because if the patient is sick enough to be on a ventilator, then they are going to become hypoxic very easily. So the patient has been hyperoxygenated. You are going to unlock this. Do I need a mask for this procedure? No, because the whole thing is closed. The whole thing is sterile. But you know what? It's always a good idea to put gloves on, because gloves are going to protect you no matter what. This patient may or may not be awake and alert. Even if they're not awake and alert, I always tell them what I'm going to do, because you never know when they're going to wake up. I'm just going to suction you a little bit. You might feel like coughing. I need you to give me a nice big cough. The bigger the cough, the more mucus I get. The more mucus I get, the better the patient outcome. Okay? So I'm hyperoxygenated the patient. What I'm going to do is feed the catheter down until I meet a little bit of resistance. Press the suction control. Pull it back out. Done. I can do this 2 or 3 times. You can use this port over here to add some saline to clear out your line, or you can place it into the patient's lungs. You want to make sure that that's closed when not in use. So after you're done suctioning the patient, you're going to lock it back up. You're going to document how the patient tolerated it, what kind of secretions you got out, the amount, the type, the color, those type of things. And I think that's it.